Most people have no idea, but the way you sleep tonight could quietly increase your stroke risk while you rest. One common sleeping position is putting dangerous pressure on your blood flow, especially as you age. In the next few seconds, you'll discover the position doctors warn about and how to fix it before it's too late. If you sleep on your right side, stop immediately. I'm serious. That position you're in right now, the one you think is comfortable, might be slowly restricting blood flow to your heart every single night. And here's what terrifies me as a doctor who has spent decades studying how the body heals itself. 30% of all strokes happen between midnight and 6 a.m., not during the day, not during stress, while you're asleep. I'm Dr. William Lee, and in the next 15 minutes, I'm going to show you 5 sleep positions ranked from bad to deadly. But more importantly, I'm going to give you 2 positions that could genuinely protect your brain tonight. Here's what I need you to do right now before we start. Comment below and tell me, back sleeper, side sleeper, or stomach sleeper. Because in the next 60 seconds, I'm going to tell you if your habit is on this list. And if you're over 60, what I'm about to show you isn't optional anymore. Let's start with number 5. Number 5, sleeping completely flat on your back, with 0 elevation. Now I get it. This feels natural. Your spine is straight. Some people swear by it. But here's what your body is actually doing when you lie completely horizontal, especially after 60. Blood pools toward your head. Gravity isn't helping you anymore. It's working against you. In your 20s, your blood vessels are flexible enough to handle this. But after 60, those vessels get stiff. The tiny arteries in your brain become fragile. And when blood pools in your head for 7 to 8 hours straight, pressure builds inside your skull. You know that pounding headache you get at 3 o'clock in the morning? That's not random. That's intracranial pressure. Your brain is literally being squeezed by excess blood volume that can't drain properly. Research in the Journal of Clinical Sleep Medicine studied this exact phenomenon. What they found, even a 15-degree elevation of your head significantly reduces this pressure and improves blood flow back to your heart. Here's what most people miss. Someone wakes up dizzy. They sit up too fast and feel lightheaded. They think, "Oh, I'm just getting older." No, that's a warning sign that blood flow dynamics during sleep aren't working. The fix is simple, and I'll give you the exact position at the end. But first, you need to hear number 4 because this one shocks most people. Number 4, sleeping on your right side if you have any history of heart issues or high blood pressure. Now this sounds oddly specific, but listen to the anatomy. Your heart sits slightly left of center in your chest. When you lie on your right side, your body weight shifts, and one of the largest veins in your body, the inferior vena cava, gets compressed. This vein is responsible for returning blood from your entire lower body back to your heart. Even mild compression means your heart has to work harder to pull that blood back in. For a healthy 30-year-old, not a big deal. For someone over 60 with borderline heart function or high blood pressure, your heart is already working overtime. Now add 7 hours of extra workload every single night. Here's what cardiologists have noticed. Patients with heart failure instinctively avoid sleeping on their right side. It feels uncomfortable. That's your body telling you something isn't right. The European Journal of Heart Failure studied sleep positions in heart patients. Left side sleeping was associated with better blood flow stability and less strain on the heart overnight. Let me show you what this looks like in real life. Someone has managed their blood pressure for years. Medications are stable, but every night they sleep on their right side. No dramatic symptoms, but their heart is compensating, working harder than it should every single night for decades. That cumulative stress doesn't show up on a daytime blood pressure reading. It shows up as a stroke at 4 a.m. If you commented right side sleeper earlier, keep watching. Number 3 might apply to you too. Number 3, using 2, 3, or even 4 pillows stacked under your head. People do this thinking it helps with breathing, acid reflux, sinus drainage, and yes, some elevation helps. But here's what excessive elevation does that nobody talks about. Your neck bends forward, not slightly, dramatically, and running along both sides of your cervical spine are the vertebral arteries. These are critical blood vessels that supply your brainstem, your cerebellum, the parts of your brain that control balance, coordination, and consciousness. When your head is pushed too far forward by stacked pillows, these arteries get compressed. You won't feel it in the moment, but over time, chronic compression reduces oxygen delivery to these vital brain regions. Ever wake up with a stiff neck and a dull ache at the base of your skull? That's not just muscle tension, that's restricted blood flow. The Journal of Manipulative and Physiological Therapeutics examined how neck angle affects vertebral artery blood flow. Extreme forward bending measurably reduced flow. Now, that study wasn't about sleep specifically, but the principle is the same. If your neck is in a compromised position for 8 hours every night, the cumulative effect matters. Here's a pattern I see constantly. Someone wakes up every morning with neck pain and a headache. They assume it's stress or age. Then they switch to one properly contoured pillow. Within a week, symptoms disappear. One pillow. That's it. But we're only at number 3. Number 2 is where things get concerning. Number 2, sleeping in a tightly curled fetal position. This is one of the most common postures, especially for older adults. It feels protective, safe, instinctive. But from a physiological standpoint, this position creates 2 major problems. First, your lungs can't fully expand. When you curl up with your knees to your chest and your chin tucked down, your rib cage compresses. Every breath you take all night is shallower than it should be. You know that feeling when you wake up and can't take a deep breath right away, like your chest is tight? That's because your lungs have been working in a restricted state for hours. When oxygen intake drops even by 10 or 15%, your blood oxygen saturation decreases. For someone with cardiovascular issues or early lung disease, this reduced oxygenation stresses both your heart and brain. Second, your neck and upper back are under constant tension. Muscles stay contracted. Small blood vessels around your cervical spine and the base of your skull get compressed. Blood flow to your brain decreases. Research in respiratory physiology and neurobiology showed that body positions involving significant spinal flexion reduce tidal volume, the amount of air you inhale per breath, over an entire night. That adds up to hundreds of shallow breaths. Someone might wake up feeling foggy, maybe a dull headache, a little dizzy. They think, I slept poorly. Actually, their brain was oxygen deprived for hours. The adjustment isn't complicated, and I'll show you exactly how at the end. But first, we need to talk about number 1, because this habit combines multiple risk factors into one dangerous nightly routine. And if you do this, you need to stop tonight. Number 1, going to bed within 2 hours of eating a large meal or drinking alcohol. Now I know this hits close to home. Evening dinners, social drinks, it's part of life. But from a cardiovascular perspective, this is the most dangerous combination on this list. Here's what happens. When you eat a large meal, your body redirects blood to your digestive system. That's normal, but it means less blood is available for your brain, your heart, other vital organs. In younger people, the body compensates. In older adults with narrowed arteries, this redistribution can trigger dizziness, lightheadedness, even fainting during sleep. Now add alcohol. Alcohol dilates your blood vessels, your blood pressure drops suddenly. For someone with healthy, flexible vessels, this just feels relaxing. But for seniors with plaque buildup or stiff arteries, this sudden drop triggers a compensatory response. Your body tries to correct it. Blood pressure spikes, then drops again. These wild fluctuations stress vascular walls and weaken vessels. This can cause rupture. In areas where blood flow becomes erratic, clots can form. And all of this is happening while you're unconscious. The American Journal of Hypertension studied alcohol consumption and nighttime blood pressure. Even moderate alcohol close to bedtime disrupted the normal blood pressure dip that should occur during sleep. When that natural dip doesn't happen, cardiovascular strain increases dramatically. Let me paint you a picture of what this looks like. Someone finishes dinner at 8 p.m., has 2 glasses of wine, goes to bed at 10. At 2 a.m., they wake up with a pounding headache, racing heart, sweating. They think bad dream, No, that's a circulatory crisis their body is trying to compensate for. Over time, these episodes accumulate. Small vessel damage, micro strokes you don't even notice. Then one night, it's not micro anymore. If you do nothing else from this video, change this habit. Finish dinner 3 hours before bed. If you drink alcohol, stop 4 to 5 hours before sleep. After dinner, walk for 15 minutes. Just movement. This alone can reduce your overnight stroke risk more than most medications. Now those are the 5 to avoid, but here's what you should actually do instead. The first position, left side sleeping. And I'm going to tell you something most doctors don't even know. Your heart sits slightly left of center. When you sleep on your left side, gravity helps blood flow instead of fighting it. Your heart works less. Blood circulates better. Your brain gets more oxygen. That's the basic cardiology. But here's the part that changes everything. About 10 years ago, researchers discovered something called the glymphatic system. Think of it as your brain's waste disposal system. While you sleep, this system flushes out toxins, metabolic waste, proteins linked to Alzheimer's. A study published in the Journal of Neuroscience found the glymphatic system works most efficiently when you sleep on your side, particularly your left side. Let me break this down. Every day your brain accumulates proteins like amyloid beta and tau. In Alzheimer's patients, these proteins build up and form plaques. In healthy brains, the glymphatic system clears them out during sleep. But if you're sleeping in a position that restricts this clearance, those proteins start accumulating not overnight, over years, over decades. And by the time symptoms appear, the damage is done. Left side sleeping optimizes this waste clearance. It's not just about preventing stroke tonight. It's about preventing cognitive decline 20 years from now. There's another benefit. If you deal with acid reflux, the anatomy of your stomach and esophagus means left side sleeping keeps stomach acid down. You wake up without that burning sensation in your chest. Now, if you've been sleeping on your right side or your back for 30 years, this takes adjustment. Here's the practical solution. Body pillow. Hug it in front of you. It keeps you positioned left, supports your spine, and if you have joint pain, put a smaller pillow between your knees. One question I get, what if I roll over in my sleep? You will. That's normal. The goal isn't perfection. The goal is spending more time in the optimal position than the harmful one. But there's a second position that works incredibly well for specific people. Let me show you the second position. Back sleeping with gentle elevation, not flat, not sitting up, a gradual incline, raising your upper body 15 degrees to 30 degrees. You can use a wedge pillow, an adjustable bed, or carefully stacked pillows. But the key is your entire upper body elevates, not just your head. Why does this work? 3 reasons. First, blood returns to your heart more efficiently from your lower body. If you have poor circulation, swollen ankles, or varicose veins, this position helps your cardiovascular system work less during sleep. Second, pressure inside your skull decreases. For people with fragile brain vessels or uncontrolled blood pressure, this reduces the risk of small vessel rupture. These tiny hemorrhages don't cause dramatic symptoms, but they accumulate over time. They lead to cognitive decline, memory issues, what doctors call vascular dementia. Third, breathing improves. Your airway stays more open. If you have mild sleep apnea, congestion, or sinus issues, this elevation reduces snoring and improves oxygen delivery to your brain. Now here's a detail people miss. If you elevate your upper body, also put a small pillow under your knees. This maintains your spine's natural curve and takes pressure off your lower back. This combination creates what's called zero-gravity posture. NASA studied this for astronauts. It distributes pressure evenly across your body and reduces strain on joints and blood vessels. But let me be very clear, this doesn't work for everyone. If you have severe sleep apnea, even with elevation, back sleeping might collapse your airway. In that case, left side is better. If you have shoulder arthritis, this might offer relief. If you have heart failure, left side is usually ideal. The point isn't to follow a rule blindly. The point is to understand why these positions work and apply that to your specific situation. Have you tried either of these positions? Drop a comment and let me know. Left side or elevated back? I want to hear what works for you. Now, let's talk about your bedroom environment, because even the perfect position won't help if these factors are wrong. Your bedroom isn't just where you sleep, it's where your brain and heart either recover or deteriorate. Temperature first. Keep your room between 64 degrees and 68 degrees Fahrenheit. A cool environment helps your core body temperature drop, which triggers deep sleep. It also lowers nighttime blood pressure naturally, reducing strain on brain vessels. If your room is too warm, your body works harder to regulate temperature. You stay in lighter sleep stages. Your heart rate stays elevated. You never reach the deep recovery phases where real healing happens. Next, eliminate blue light after 9 p.m. Phones, tablets, TV, harsh overhead lights, all of it suppresses melatonin. This delays deep sleep stages, the ones where your brain clears metabolic waste and your cardiovascular system stabilizes. If you absolutely need a device, use blue light blocking glasses or night mode. Better yet, read a physical book. Your brain needs wind-down time without screens. Third, proper neck support. We talked about pillow height earlier. This matters more than people realize. Memory foam with cervical contour supports your neck's natural curve without forcing your head into unnatural angles. This alone can prevent restricted blood flow through vertebral arteries. Finally, noise. Even sounds that don't fully wake you jolt you out of deep sleep. Your heart rate spikes, cortisol increases. These are micro-stress events. You don't remember them, but your vascular system does. A white noise machine or earplugs create a consistent sound backdrop to mask irregular noise. These aren't optional recommendations. These are variables that directly affect stroke risk. If you want to go one step further, track your nighttime health. Your body gives you signals while you sleep. Most people just don't know how to read them. First option, an overnight pulse oximeter. A small device clips on your finger. It tracks oxygen levels throughout the night. If your oxygen repeatedly drops below 92%, that's a red flag. Could be sleep apnea, could be poor circulation, could be respiratory issues, all increase stroke risk. The data is valuable to show your doctor, especially if you're having unexplained warning symptoms. Second, heart rate variability tracking. A smartwatch or sleep ring can measure this. HRV reflects how well your autonomic nervous system is functioning. Low HRV overnight indicates stress, inflammation, blood pressure issues, metabolic dysfunction. It's an early warning that your body isn't recovering during sleep. Third, a simple sleep journal. Write down how you feel each morning. Headaches, dizziness, numbness, or tingling anywhere. Brain fog. These subtle symptoms can be early signs of poor oxygenation or restricted circulation during sleep. Patterns in your journal help you and your doctor identify issues that won't show up in a single office visit. Now, critical point. These tools are for awareness and education only. They do not replace medical evaluation. If you notice concerning patterns, if symptoms persist, if you have stroke risk factors, discuss this with a qualified healthcare provider. Self-monitoring is valuable. It's not a substitute for professional care. But here's what these tools do give you. Data, control, awareness. You're not guessing anymore. You're measuring. Let me tell you why most people never hear this information. Sleep position doesn't fit into a standard medical appointment. There's no blood test for it, no imaging study, no prescription to write. In a 15-minute visit, your doctor is checking labs, adjusting medications, addressing acute symptoms. Sleep posture. It's not on the checklist. But here's what research is showing us. Sleeping in certain positions can silently affect blood flow, oxygen delivery, pressure inside your skull, and your brain's ability to clear toxic proteins. These aren't dramatic events. They're cumulative processes, building night after night, year after year. For people over 60, for anyone managing blood pressure or cardiovascular conditions, these nighttime habits become critical. And here's the empowering part. that most health advice completely misses. You don't need a prescription, you don't need expensive treatment, you need awareness and one or two targeted adjustments. Change one habit, shift to left side sleeping, elevate your head 15 degrees, stop eating 2 hours before bed, use one properly contoured pillow instead of 3. Any single one of these changes can measurably improve how your cardiovascular system functions during sleep. You're not just reducing stroke risk, you're investing in brain longevity, cognitive clarity, cardiovascular health for the next 20 to 30 years. By watching this video, by taking time to understand these connections, you are already more informed than 95% of people. You're taking control of variables within your power to change. You now know something most doctors won't discuss in a standard appointment. You have information that could protect your brain starting tonight. That's not minor. That's significant. Here's what I need you to do today. Pick one adjustment from what we covered. Maybe it's left side sleeping. Maybe it's finishing dinner 3 hours before bed. Maybe it's switching to a single contoured pillow. Start there. One change. Give it 7 days. Pay attention to how you feel in the morning. Notice if headaches decrease, if energy improves, if you feel mentally sharper. Your body will tell you if it's working. Now, drop a comment below. Which habit are you changing first? Your answer might help someone else recognize a pattern they haven't considered. If this video gave you information you've never heard before, hit that like button and share it with someone who needs to see this. Someone over 60, someone managing blood pressure, someone who keeps waking up with unexplained symptoms. And here's why you need to subscribe right now. Next week, I'm revealing 5 specific foods that clinical studies show can reduce stroke risk by up to 30%. Not generic advice, specific foods, specific amounts. And here's the interesting part. You probably have 3 of them in your kitchen right now, but you're not using them correctly. This is research most people will never see. Information that won't come up in a standard doctor's visit, but it could genuinely change your health trajectory. Hit subscribe, turn on notifications, because if this information was valuable, next week's video is going to be even more important. Until then, sleep smart, stay informed, protect your brain. I'm Dr. William Lee, and I'll see you in the next video.